Welcome to a new episode of Science in Context. I'm Sabine, and this week Professor Helen Ward joins me to speak about the REACT study. Helen, can you explain a little bit more about the background of the REACT study?
Well, the REACT study is actually 5 years old now. We started it in April 2020 to look at how common the virus was and how common antibodies to the SARS-CoV-2 virus were in those first 2 years of the pandemic. So we were tracking in near real time who got infected, where they were living, and how it spread and changed over time.
And what were some of the most important findings from the study so far?
The most important findings during those initial years were about the inequalities in risks and who was most at risk, so people in large households, deprived areas, key workers obviously, and ethnic variations. So those were important. Once vaccination came along, we also looked at who responded best to vaccines and hoped to provide useful information on how boosters should be rolled out and so on. We also detected new variants because when people were positive, we were able to test for those and we could see changes in how transmissible they were.
And the REACT study is still ongoing. What is the main focus of the study now going forward?
Well, during those first 2 years, over 4 million people were involved, and over 3 million of those have agreed to some kind of follow-up, either through further surveys, research, or NHS data linkage. So we're continuing to follow up to see the impacts of the virus and what's called long COVID, how many people have got persistent health problems following the pandemic and following infection. But we're also working with lots of other researchers, for example, the Dementia Research Initiative, where they're trying to set up a panel of people who are ready to take part in dementia prevention trials. We're approaching people in REACT and saying, you've previously taken part in research, would you be interested in doing this? So it's very valuable for that. And we're also doing pandemic preparedness, if you like, surveillance for other conditions such as influenza-like illness, which we're doing jointly with the UK Health Security Agency.
Thank you so much for your time today.